So I'm a part of this coalition because I've been in the education business since 1993. So I've had an opportunity to see a lot of kids grow up, and oftentimes when kids get involved in substance abuse, they are not able to reach their fullest potential, and I want kids to reach their fullest potential. So through this work with the coalition, I'm able to help ensure that that can occur. I got involved in the coalition through my work at an alternative middle school. Previously was on Central's campus. It was an alternative middle school for kids that were, I would say, disenchanted with the educational system that they had been experiencing. And so a lot of those kids had lots of issues that were in their lives, and some were certainly involved with substances. And so I actually gleaned the help from the coalition to support some of those students. So it was good work.
So far, working with them, I think one of their greatest accomplishments is getting as many people together to work on this issue as they have. I think we've got a representative from every aspect of our local health jurisdiction, from law enforcement to schools to the health department to the hospital, working on this issue together, which is a huge feat. I also think that they've brought a lot of programs to light that wouldn't have support if the coalition didn't exist. Love and Logic, a lot of the safety programs, the ACEs task force, things like that. They're bringing light to a lot of topics that I don't think people would know about necessarily if the coalition didn't exist in the community.
I'm passionate about the prevention of underage drug and alcohol use just based on my personal history of growing up in a family where there was alcohol and drug use at the time. So I have a very personal passion looking at the importance of that, as well as going throughout my professional career and seeing the impacts that it has on individuals by the time they get to the college setting, and knowing that early intervention really would have a major impact on them. I work with students who have substance abuse issues through our wellness center, as well as through our Student Rights and Responsibilities office. And so there's a lot that we do in terms of the education and the promotion pieces, very much similar to what we do in the coalition, what the mission and purpose is there. And then just personally is just being a positive role model and being active in the community to get that message out there, so that way everyone gets the same messages on the same page and opens up those lines of communication. The coalition itself is really vital, and I've seen it grow over the last several years because I think the community is aware of the importance and the benefit that activities like this have, and getting more people involved in it really does open up the conversation and the message to get it as a unified response.
If you're really interested in the work that we're doing, you could become a part of our coalition through joining a subcommittee and working on a variety of different issues in the community. If you are interested in being involved but you don't have a lot of time to give, we would love to have you be a part of the activities that we do throughout the year as a coalition. We have town hall meetings, we have different campaigns like Safe Homes that you could become a part of. And if you are wanting to be a part of the coalition but really want to just know what's happening in the community and know more about substance abuse prevention, you can like us on Facebook and become part of that campaign and just regularly educate yourself on what's happening and what's the latest information we know about substance abuse.